Our next condition is constipation. And I know this might seem a little out of place. We've been discussing a lot about pain here, neck pain, back pain, elbow pain, all of these really nice pain conditions that acupuncture can be used for. But constipation is one of those things that I see in almost every person who walks through my door. And it's a condition that clients usually are pretty reluctant to talk about. They might be a little bit embarrassed, but I always do ask about it in my intake because acupuncture is almost always a slam dunk for constipation. So you can really help a lot of people by learning the techniques that I'm going to teach you here. Constipation is infrequent bowel movements or difficulty passing stool. The clinical diagnosis is less than 3 bowel movements per week. Stools are often dry, hard, and difficult to pass. And constipation is usually accompanied by bloating, abdominal discomfort, sometimes nausea and vomiting as well. Again, this is one of these conditions where you're going to want to be acquainted with the red flags. So always screen your clients for a couple of things. Blood in the stool, vomiting blood, these are always red flag conditions that you want to refer your client out. Any weight loss, sudden unexplained weight loss, night sweats, or constipation that has lasted for more than 3 weeks without any improvement, these are all cause for concern and you'd like to refer your client out appropriately. The causes of constipation, this is most often linked to diet. So poor diet, also lack of water intake, and a sedentary lifestyle can cause constipation. Change in routine. So for example, if someone has, like a different job and they've changed their hours, this can also cause constipation. And there's also an emotional component here too. So stress, anxiety, and depression can also be culprits. Medications, including over-the-counter medications such as NSAIDs or NSAID pain relievers, can cause constipation. Sometimes over-the-counter antihistamines can also cause this condition as well. Antidepressants are often a culprit for constipation, as well as supplements which contain iron. So oftentimes a multivitamin, and if you have a female client who's taking multivitamin containing iron, that's also probably going to be the likely culprit here of constipation. Endocrine conditions such as thyroid conditions can also cause constipation. IBS, irritable bowel syndrome, can also cause this, and this can also be an issue during pregnancy. The traditional diagnosis is fluid and blood deficiency, as well as chi stagnation. We'll now apply acupuncture for constipation. So I'll begin with local application here on the abdomen. And you'll want to have a nice clear view of your client's abdomen. And we'll begin with points on the spleen channel, but also other affected channels include the kidney and the liver, as well as the triple burner. In the fundamentals course, I referred to the triple burner as the channel that pretty much involves everything. So when you're dealing with a systemic condition such as constipation that pretty much deals with every part of the body, you always want to make sure that you're using the triple burner meridian as well, because it's going to even add even more emphasis to your treatment, because it's the triple burner that makes the connection throughout the body. So we'll begin here with the spleen channel, and you'll find these points on the lateral border of the rectus abdominis. So it's the six-pack muscle basically, and these are level with the umbilicus. So you find the belly button, the umbilicus, and it should be a pretty obvious drop off here. So this is the lateral border of the rectus abdominis. If it's not necessarily prominent for your client, you can always palpate. So this should be about 2 inches away from the umbilicus, and you should feel a drop off here, and you can palpate and definitely feel that drop off. So we'll place the needle directly on the lateral border of the rectus abdominis, and you want to be really cautious when you are needling the abdomen. So this is a perpendicular insertion, and there are a lot of organs directly under here, but the abdomen is covered with what is called the peritoneal cavity. This is a really thick layer of connective tissue that basically holds in the abdomen. So you do not want to penetrate the peritoneal cavity wall. That's where you're starting to get into touching organs with needles, and that's what we don't want to do. So you'll insert your needle, and you'll have about 1 inch to 1.5 inch insertion, just depending on your client's anatomy. If the tip of the needle runs up against any resistance whatsoever, that is the peritoneal cavity, and that's your cue to stop. On most people, just depending on their anatomy, you can go anywhere from 1 inch to 1.5 inches. You want to make sure that this needle is, placed pretty deeply, but again, if the needle meets resistance, just leave the needle alone. It's in the proper place. I like to needle this bilaterally because we're working with the ascending, transverse, and descending colon. So again, we're on the lateral border of the rectus abdominis, level with the belly button, And you can always palpate and feel where that lateral border ends. If your client has a lot of musculature in their abdomen, it can be more difficult for you to needle into this space. So just always encourage your client to breathe and relax, and that will really help to relax the muscles of the abdomen here, and it's easier for you to place a needle. So these are both needles directly placed here, perpendicular, level to the surface of the skin, directly on either side of the umbilicus. The next point I will show you locally for constipation is on the kidney meridian. And this is going to be located 1/2 of an inch lateral to midline, and then it's going to be 2 inches below the umbilicus. So you'll find this point just 1/2 inch, it's not very far off of midline, and you're just going to needle perpendicular straight into the abdomen. This is on the kidney channel, and this area of the kidney channel in Mandarin is called Sip Man, and what this means is 4 fullnesses. So this area on the kidney channel helps to dispel the 4 fullnesses of chi, blood, food, and water. So this is a really nice area to help relieve constipation because it helps to relieve the stagnation that can be really present in this area. Oftentimes in a constipated client, this part of the abdomen is distended, it's bloated, it's really uncomfortable. So these points help to dispel that stagnation that's sitting in there. So that would be the placement of these 2 points, 1/2 inch away from the midline, the central midline of the body, 2 inches below the umbilicus. I'll now show you some distal points for constipation. And with this, we're going to be working with the kidney and the triple burner meridians. And I'll show you here the triple burner point on the forearm. So this point is located 3 inches proximal to the wrist crease, and it's directly between the radius and the ulna, but it's on the ulnar border of the radius. So you can palpate the radius, and directly here on the ulnar border, there's a depression. So it's not smack into the middle of the 2 bones. You're a little bit closer to the radius. So you insert this point going right up against this ulnar border of the radius bone, just perpendicular, 1/2 to 1 inch insertion. The next distal point I'll show you is on the kidney channel, and this is on the medial malleolus. And you can locate this point between the tendons of the posterior tibial tendon and flexor digitorum longus. And you might need to move the ankle around a little bit in order for these 2 tendons to become prominent to you, but you can see them right here. And the point is located directly between these 2 tendons, and this is the bottom border of the medial malleolus. And you'll insert this point and you'll direct it obliquely upwards. And you're not trying to get really in the ankle joint space. So this is a small insertion, 1/4 to maybe 1/3 of an inch. And what these 2 points do together, the triple burner point here on the forearm combined with the kidney point on the ankle, is both of these points help to increase fluids in the body as well as regulate chi and blood. So I like to say that you have to float the boat before you can move the ocean. So this kidney point here really increases yin fluids in the body. There's often that dryness component of constipation, so that's what this area of the body treats. And there's also that stagnation component, so that's what the triple burner point on the forearm treats. So both of these together are a really nice combination in terms of a distal application of acupuncture for constipation. And finally, I'd like to show you some distal points for constipation that are located on the forehead. And because there is usually such a strong emotional connection with constipation in terms of stress, anxiety, or depression, it's always really nice to add these points in. And you can feel free to add these points into any treatment where you feel like your client could use a little bit extra emotional wellness. And the first point is located directly here between the brow, and you'll locate that point and by pinching up the skin in between the brow, and then you'll needle the point transversely straight down towards the nose. And that is a really nice way to calm spirit. That's actually the name of the point. It helps to calm spirit, and it helps to spread the chi out, and it helps to calm the shen. Now, I like to pair this point with a dui yao, especially in cases where someone is really having a big emotional component to their illness and you think that they could use a little bit of an extra push. And you can find this point directly on the same midline as this point between the brow, and this is located at the hairline. And you'll use the same method here. So you'll just pinch up the skin and then needle in a transverse direction straight down towards the first point that you placed. And both of these needles together have a synergistic effect of really calming the shen, calming the spirit. And I like to place both of these needles whenever I feel like someone has a strong emotional component to what they're coming in to see me about. So feel free to use this combination, not just in treating things like constipation or frozen shoulder or TMD, but anytime you feel like your client could use a little bit of extra emotional support.